So welcome to this talk by the Australian Institute of Vigilancy, the Global Fund to fight AIDS, TB and malaria, and the fight against COVID-19. This is a hybrid event being held both in person in Brisbane and online for interested members and members of the public throughout Australia and internationally. My name is Graham Kerridge and I'm a member of the State Council of AIIA. I wish to acknowledge the traditional custodians of the land on which we're gathered for this in-person event, the Turrbal and the Jagera people, and pay respects to their elders, past, present, and emerging. We are very honoured tonight to have as our speaker, Lady Roslyn Morauta. Lady Roslyn is originally from Australia, indeed from Queensland, and studied in Queensland before working in publishing in the UK and then teaching politics at the University of Ghana, at ANU and University of Queensland. Since 1982, she has worked and consulted in economic planning in PNG, both in the public sector and the private sector, before moving into private business in PNG. She served as First Lady of PNG while her late husband, Sir Macquarie Morauta, was Prime Minister. Lady Roslyn has a long association with improving the health standards and addressing gender and HIV issues in PNG. For many years, she's been a leader in the contribution of community-based and private organisations can make in the fight to address health and HIV issues. She has long been active on the PNG country coordinating mechanism, which leads the planning coordination of efforts to address HIV, TB and malaria in PNG. And then in 2019, she was elected as Vice Chair of the Board of the Global Fund to fight HIV, TB and malaria. The Global Fund, based in Geneva, is a partnership between donor and recipient countries, private sector groups and civil society organisations, particularly those of people affected by the three diseases. Since 2002, it has been dispersing performance-based grants to address the three diseases at a rate of approximately $4 billion per year, making it the largest funding channel for TB and malaria in the world, and the second largest funding channel for HIV after the US government. The Global Fund is rated very highly for aid effectiveness by Australia's Department of Foreign Affairs and Trade, and is one of a small number of multilateral funds that Australia has been consistently supporting. The most recent pledge for the 2020-2022 triennium being for Australian 242 million. It's particularly significant that we're hearing from Lady Roslyn tonight, as Sunday the 25th was World Malaria Day, and the efforts to fight malaria have been severely impacted by the COVID-19 pandemic. Indeed, the pandemic has threatened the fight against the three diseases and set back progress that has been made and plunged approximately 95 to 115 million people around the world into extreme poverty. Lady Roslyn will discuss how the Global Fund has approached its role in providing performance-based grants for the three diseases in the time of COVID. And at the end of the presentation, there will be an opportunity for questions to Lady Roslyn. Those online are requested to send their questions through on the chat function in Zoom. We'll finish the event at 7 p.m. Please make Lady Roslyn welcome.
The fight against malaria is one of humanity's biggest public health successes. The world has seen 1.5 billion cases averted and 7.6 million lives saved over the last 2 decades. Global malaria mortality fell by 60% over the 20-year period. But in the last year, as you all know, we've been battered by a new disease. COVID has impacted health services for HIV, TB, and malaria across low and middle income countries and has had a devastating impact on economies, societies, and people's lives. Disruptions to health services mean that people are not being as widely tested, diagnosed, or treated for HIV, TB, and malaria, threatening the gains that the Global Fund has made so far in the fight against these three diseases. In a Global Fund survey last year of 500 facilities in low and middle income countries, we found that HIV testing had fallen 41% between 2019 and 2020. TB referrals, where patients suspected of having TB were referred to the next step of diagnosis and treatment, had fallen 59%. Malaria diagnoses had fallen 31%. Antenatal care first visits had fallen by 43%. Moreover, spot checks revealed critically low availability of COVID-19 commodities. Only 45% of the facilities surveyed had at least 4 of the most essential items of PPE available to all staff: masks, disinfectant, gloves, and hand sanitizer. Across 24 countries in Africa, only 11% of health facilities could conduct COVID-19 antigen rapid diagnostic tests, and only 8% could conduct polymerase chain reaction, the PCR tests. The knock-on impact of COVID-19 continues to escalate, and the pandemic threatens to roll back decades of hard-won gains against TB, HIV, and malaria. In the last year, the Global Fund has deployed $1 billion to fight COVID-19 and mitigate the impact on HIV, TB, and malaria programs, using redeployed internal funds and contributions from donors, including Canada, Denmark, Germany, Italy, Sweden, Norway, and the FIFA Foundation. The Global Fund is also a founding member of the Access to COVID Tools Accelerator, ACT-A for short. This is a global collaboration to ensure the accelerated development and equitable deployment of tools to fight COVID. ACT-A has 4 pillars. The one you've probably heard of is COVAX, the vaccines pillar. This is a global risk-sharing mechanism for pooled procurement and equitable distribution of COVID-19 vaccines. COVAX has so far shipped over 40.5 million COVID vaccines to 118 participants. Defeating COVID requires a comprehensive approach that brings together testing, treatments, vaccines, and the health systems and medical supplies to make it happen. Vaccines alone will not be enough. Due to the unknowns with regard to new variants and evolving virus and duration of current vaccines, we cannot rely only on vaccines. We need more than one line of defense to combat this pandemic. Testing, treatments, medical oxygen, and PPE are all vital. The Global Fund is co-leading the diagnostics and health system pillars of ACT-A and supporting on procurement and distribution for the treatments pillar. Through the ACT Accelerator and with the extension of our COVID-19 response, the Global Fund is now the primary channel for providing grant support to low and middle income countries for tests, treatments, including medical oxygen, PPE, and health system strengthening. As a result of concerted effort and collaboration amongst partners in the diagnostics pillar, we were able to speed up the availability of diagnostic tests funding is essential for early detection and containment. The second largest funding gap is health system capacity, $7.3 billion. This pillar focuses on rapidly identifying and address procurement of PPE that is a crucial tool. The $3.2 billion in pipeline. As we've seen, medical oxygen is vital for effective treatment of hospitalized COVID-19 patients. The harrowing scenes from India in the last week, as thousands have died for lack of life-saving oxygen, have highlighted the urgency more than any speech can. For the Global Fund to fulfill its responsibility to the ACT Accelerator and regain lost progress against HIV, TB, and malaria, $10 billion is needed today. To date, in 2021, we've managed to raise $3.7 billion from donors, including Germany and mostly from the United States. We're therefore looking to other donors to step up too. Since the COVID-19 pandemic began, Australia has committed over 1.1 billion Australian dollars to support key strategic countries in the Pacific and Southeast Asia to respond to COVID-19. This funding has been channeled mainly through bilateral aid and primarily for immunization. And currently, Australia is focusing on the spiraling COVID-19 outbreak in PNG and responding to that emergency. With a significant amount of commitment to COVID-19 response in the region, it would be tempting to think that Australia is providing sufficient support to the COVID-19 response. However, Australian assistance is significantly skewed towards the Pacific and Southeast Asia. And with the rapid spread of contagious variants and risk of further mutation, the need to reduce global prevalence everywhere cannot be stressed enough. New mutations of the virus underscore the urgent need to contain COVID in all countries. Even if wealthier countries succeed in rapidly rolling out vaccine and containment campaigns, if we do not do the same in low and middle income countries at the same time, the virus will continue to mutate and will pose a new threat to everyone, even countries that managed to control the original COVID-19 strain. The virus and its variants do not respect regions or national borders. The rate of mutation is a function of how much virus there is in the world, not just how much is in our region. The more infections are reduced, the longer and more effective the COVID-19 tools will be. We all need to reduce the infections everywhere, and that requires action on a global scale. Australia's contribution to the ACT Accelerator is $72 million, or just 0.5% of the $14 billion raised so far. Given the size and wealth of Australia, advocates have argued that a contribution of at least 10 times that amount would be an affordable and a fair share of the $33.2 billion required this year. There's obviously a moral case for doing more, but much larger support would also be in Australia's interests. The COVID-19 pandemic is proving that health security threats are not just public health crises, but economic crises too. The IMF estimates the pandemic will cost the global economy $28 trillion in lost output by 2025. The total fiscal cost of COVID is already some $16 trillion. Australia, for example, has spent more than $300 billion on its domestic response and will see an increase in debt of $590 billion by 2022, just next year, compared to the pre-COVID level. A fully funded acceleration would allow but is it enough? 14.1 billion has been raised for response to COVID, but through the act acceleration, $7 billion for the global fund to play its part in diagnostics, treatments, and health systems. So whilst I'm hopeful, because I've seen what can be achieved in the fight against HIV, TB, and malaria, action is needed and urgently AIDS in the early 2000s. Fighting COVID will require all of us, donors, the private sector, government, and communities to join forces. Fighting COVID will require rich countries to step up, not only because they have the resources to do so, but because it's in their interest to do so. Australia too should step up.
Thank you, Lady Ros, for that stimulating discussion. As people are focused on the health imperative for addressing COVID, there's a very strong economic imperative to step up urgently as well. Lady Ros, I would welcome, since you are in the room where it happens, as to whether you have any views on how the countries around the world are reaching that awareness of the need to step up in their contribution for international support, despite the challenges that they all face domestically.
Thanks, Graham. I think it's fair to say that, as a general statement, that the richer countries are focused on themselves. There has been some support to low and middle income countries, but not nearly enough. I think in Europe, there's an increasing awareness that more needs to be done. I know the President of France held a number of discussions just in the last week with all leaders in Africa, realizing the terrible situation there and thinking about what more France could do. But you can see from the numbers that I gave that the gap is so huge. So we have to change the thinking very quickly if we're to get on top of this pandemic. And I think Australia particularly has been very much focused on the domestic response with some attention to the region. But the amount of money that has been given, even counting what we've given to the region, is nothing compared with what is required. Nothing at all. So I think we all have a responsibility to try and change the dynamic of the debate. Very difficult, I know. Someone in Canberra mentioned to a friend today that for Australia to do more, they might have to smuggle the money out on their first day, which is a very sad statement about the views of the majority of the electorate, if that's the case. I mean, we've seen a major decimation of foreign aid in the UK, in Australia, in recent years. I mean, the UK's cut its aid budget by half in the last 12 months. It's just shocking. So those of us who do believe that we have a responsibility, but also that it's in our interest, we somehow have to participate in the debate and try to change views.
Can I invite questions from the audience?
You look at the history of pandemics and you see they've come along at intervals and they've been deadly. You know, the end of World War I, you had the but some people are saying that with overpopulation, with climate change, and also with humans moving more and more into a natural environment, that these type of pandemics that spread from animals to humans are going to become more and more likely, and that pandemics won't come along every 50 or 100 years. They're going to be coming much more closely together. Do you think that this is a danger and a worry for you?
I think that seems to be the general view of epidemiologists, that we, you know, if it's not COVID-19, it's going to be something else very soon, which highlights the need for the strengthening health systems around the world, so that there is some preparedness to fight pandemics, no matter what it is. If it's not COVID, there will be another one. So that's why just a COVID vaccine is not the only answer if we're taking a longer term view.
Thank you very much.
Thank you, Lady Ros. I was wondering if where you've obviously covered a whole lot of different responses for this very serious matter. And of course, there are immediate responses that must be made, vaccinating people, PPE, and those sort of things. What is the lasting response, though, that the West can do for the whole world? I look at Australia, I mean, we are now realised the sovereign risk problem we have in not manufacturing enough drugs in this country ourselves.
But it does come back in health. So, but also strengthening economies. This global fund replenishment, we had a big increase in domestic health expenditure in the last 3 years. And in working out that we needed $14 billion at least to do the work that we wanted to do, that was also factored on the premise that there would be health. Now, obviously, COVID has totally destroyed that, because economies have just been a gloomy prospect in the near term. But we have to work to strengthen economies. We have to work to strengthen health systems. The only two factors that can help low and middle income countries cope with these kinds of problems more.
Are there any programs that will invest in to develop pathology capabilities? For example,
yes, there are. There are, both bilaterally, so through the Global Fund. Australia's contribution to the Global Fund is we were checking the statistics of Canada. When you think, what's a country that's most like Australia in the world? I think probably Canada is in terms of size, a little bit bigger than us, but similar type of economy. Canada gives twice as much on a per capita basis to the Global Fund and to many other multilateral organizations as well than Australia does. So, you know, I think we need to do far more. The bilateral aid program does, in some countries, cover these sorts of things. Part of the Australian increase to the Global Fund for this period included quite a bit of technical assistance. A lot of that is going into laboratory strengthening in the region. But we can do far more.
Russell, apart from addresses to the AIIA community, does the Global Fund have ways in which they could begin to influence Australian attitude?
Well, we do have regular meetings with the Australian government, both officials and politicians. In fact, I had a call
Well, I'm thinking more of the Australian public.
Well, a little bit. I mean, we do publish information at different points. People have spoken at different occasions. I wrote an article for World Malaria Day with the head of the Asia Pacific Leaders for Malaria Alliance that was published on Sunday for World Malaria Day on malaria in the region. But I guess that's still a limited audience, the people who are reading these things. We do try to get out in the mainstream media. When senior people visit, we manage to get a little bit of media profile, but it's very hard. Any suggestions would be welcome. No.
Thank you very much. Very informative presentation. The question is, the world is not just the COVID, but we are very much expecting that any time, any pandemic, you know, this is if not COVID, then so we are. I mean, we have to be used to live or coexist with pandemic, and so are the different programs, different disease interventions, prevention or protection measures. The human being is so much exploiting the nature that that you know, our presence, I mean, humans' presence is everywhere. So we're disturbing too much to the nature. So we have to have the consequence of it. So, like, it's not just the HIV/AIDS, malaria, or TB, but many of the chronic diseases also are being impacted by the COVID. And you see the many people are dying of the chronic conditions like heart disease, chronic, you know, the kidney diseases, many people. So, as I said, that we have to live, you know, and coexist with those kind of pandemic threat. What are the actually the contingency measure or any strategy from you know, programs such as this, the Global Fund, because you never know how long the COVID will last. Also, what is the next one? So we have to have the strategy to deal with this kind of situation for protective period. So do you have any like insights of the policy level discussion Global Fund has? Sometimes I mean, in many cases, we often complain about the fund shortage. I mean, every intervention is suffering from the shortage of funds. You know, we never have
enough money.
Yeah, enough fund for any program, not just the Global Fund. This is the reality. So what is the strategy? How best we could manage whatever we have when it comes to the real life, you know, situation?
I think, yes, very good question. I mean, it comes back to the point we were making previously about health systems. But even just in the way that we go forward in the immediate term with COVID, it's why the treatment and the diagnostics is so important. And the diagnostics can be used for many other diseases too. Building that sort of capacity is of general use. It's not just for COVID. And interestingly, a lot of tools that are used to treat diagnose and treat TB have been really important in COVID. The most effective testing is being done through the gene expert machines, or the most accurate testing. And we've been able to roll out that quickly, and people are already trained in it, so they know what to do. It's just a different part of the process that needs to be done for COVID, and a different cartridge to be used. But all of those, you know, the machines we've supplied for COVID can also be used for TB and for malaria when there is no COVID. So there are lots of things that can be done that should help countries prepare better and to live with and fight new pandemics. But we must not just concentrate on the vaccines. I mean, we all need the vaccine now, but there's another whole story, because a lot of countries will not get the vaccine in the quantity that the West will get for a long period. So PPE is really important. All the diagnostics, the treatment, really important. There's quite a lot of interesting work happening with treatments too that is quite encouraging. And I think will prove to be very beneficial. But the way the world has responded to COVID and the enormous amount of collaboration and the amount of money that's gone into developing vaccines and treatments, I think also augurs well for public health for the future. We've seen that we can collaborate a lot better. There's never been the scale of collaboration amongst the private sector, as well as governments and technical agencies, for anything that we've seen with COVID, which I think is a good thing. We need to make sure that that continues post-COVID.
Lady, I think maybe it's time that the governments all around the world put a levy on for, in the future, developing these vaccines and so on. I think we fell a little bit asleep because the economies were doing so nicely and we had fun all over the world, but I think we came a little bit slack, and we've got something that there are future funds available, and I think it's time that do carbon taxes and do other taxes. I think everybody in the world should be paying a tax, and then we have money in the kitty to do something. I think that will be the answer now.
I think we need to look at fiscal regimes everywhere, the developing world as well. There's a huge scope to increase the fiscal base in nearly every country. And it's a very good point. We will need to do that if we're going to find the resources. We can't just borrow forever into the future. We have to somehow pay this debt too.
And thank you very much for your talk. And I was most impressed by all those statistics. I wish I could remember them. I mean, they're very enlightening. I'm just wondering if I could ask about, you said the world need to collaborate. I'm just wondering if you would like to evaluate some of those other countries that often we think of as baddies, people like Russia, you know, China,
Yes, well,
Iran. Have they contributed? Turkey?
Not to the Global Fund. They are giving some bilateral assistance to individual countries. And China, of course, has developed, or Russia too, vaccines that are being used in many countries. I understand that the main Chinese vaccine is just about to be approved by the WHO. So that's the case. Yes, that's the case, Nora, isn't it?
Yeah.
So that will make it much more accessible for countries, because Papua New Guinea, for example, we would never use a vaccine that wasn't approved by WHO or any medication. That's the standard. It has to be on the list of WHO before, even though we do have some fake medicine here and there, so on. But to get through the regulatory approval, it has to be WHO approved. So, I mean, China, Russia, I imagine too, has quite a big pharmaceutical industry, but China has a huge one, which can be a huge benefit to the rest of the world. And I think, yes, obviously China will probably use the vaccine in a way that works in its interest, but I think all countries do that with aid. So it's no different from anywhere else. I don't know too much about the Russian vaccine. Maybe Noah, you do.
65 countries currently receive
Sputnik.
Sputnik 5.
Yeah.
Sputnik India.
Yeah. Yeah, so Africa, I know a number of African countries have used it.
Brazil as well.
Yes.
One of the, users from
But there
Brazil.
is some capacity all around the world for greater production of all of these kinds of medications and vaccines. I mean, Indonesia has a big pharmaceutical industry. Bangladesh has a big pharmaceutical industry. There are many countries that could actually be involved that at the moment have not been given approval to be involved. Iran, I don't really know about. I'm sorry.
We heard they were very badly affected in the early stages.
Yes.
But, what they've contributed.
No.
Well, one of the in the early days of the vaccine trial, there's a list of hundreds of the companies, pharmaceutical companies and governments listed on with the WHO's register. Iran, several companies from Iran, I remember as one of them as well. I don't know whether they succeeded or not with the clinical trial, but they were the contenders.
I mean, India, of course, has a huge pharmaceutical industry, but now it's been constrained by needing to have vaccine and treatments for the local population. So what we had expected to be exported from India is not coming through at the rate that we had hoped, which is causing a problem for many countries.
Isn't that going to be a regular problem when your economy is not going up? Because if you're looking at more viruses to continue to come in different forms, and you're going to have lockdowns or shutdowns in different economies, so you're not going to be able to make money the way you made as any country, and then you got this. What does really happen to the value of money? Do we really want to look at the value of money to say that is it worth more than the life itself? It's a philosophical question in my mind. It's not something where you can do it with numbers and say, this is how you're going to manage it. But when you look at the whole countries in the last year, everyone contained. In Australia, we became Queenslanders more than Australians. EU became France and Germany and all those kind of things. So, and US, the red and blue states behave differently. How does that going to affect if the number of the pandemic viruses increases? So we are trying to deal with one. Let's say there's three all of a sudden. There's no money. There's no economy. Where is the world going to go? I mean, it's difficult.
It is difficult. I mean, the world as we know it has just changed so much in the last year, hasn't it? And it's hard to see it going back to how it was.
Okay.
Hi, thank you for your presentation. I just had a quick question about the Debt to Health program that the Global Fund has implemented. I believe Germany and Indonesia have just signed an agreement through this program. Just two questions. How successful has this program been? And do you foresee it, if so, it has been successful, do you foresee it being a significant aspect in generating more foreign aid during the current pandemic?
Well, it could be. The way the current scheme works is that if a donor country agrees to convert some of that debt, the country still pays the money back. It's not debt relief, it's rediversion. So instead of a country paying that money back to the donor, the finance company or government that gave the money, it pays it actually to the Global Fund and then comes back to the country. So it's a way of really, instead of the country paying it as debt, the country pays it in order to fund more public health programs through the Global Fund. Australia has done one debt to health agreement with Indonesia a few years ago. Germany has done a few. I know quite a lot about it because I, for years, was trying to negotiate with the PNG government for a German loan to be converted. And we had it all there ready when COVID hit, and then the Treasury said, oh, no, we have to do that, which is, I just don't understand it, because you've got to pay it back anyway. So why not pay it back to yourself and use it on health? It's a terrific mechanism, but it hasn't been used a lot. It hasn't been used a lot.
Why has it not been used a lot?
Oh, I think donors just want to get repaid their loans, really.
Also, if I may chime in, increasingly foreign assistance is not in the form of loans. Yeah. The Global Fund grants are very much direct grants rather than loans. And so the number of
the number
loans,
of bilateral loans,
that's right,
has gone down in these sorts of areas, but there's still a lot of multilateral through the ADB and worldwide for health and education and so on. That, of course, on better terms generally than commercial finance, but there's still scope to use it far more than it has.
Thank you, Lady Roslyn. Just going back to what a point you made earlier, does the Global Fund have a position on whether intellectual property rules should be varied or amended in order to allow for greater construction of vaccines?
We don't have an official policy, no. We would follow the WHO in all of those policy aspects. We do, however, work very much in the market shaping area. We've been able, because of the quantity of drugs that we have purchased with Global Fund money, we have been able to significantly reduce the cost of drugs for the 3 diseases and now even for COVID. So we play a very big role in market shaping, but and obviously where there are good generics, we would want to use generics. We have a huge procurement platform, particularly for African countries who are very dependent on HIV, on antiretrovirals through the Global Fund. But the cost of drugs in the last 20 years for all of those diseases has come down enormously. The one area where perhaps there's not been the same success is for TB. There's not nearly enough money going into TB globally. It's really very small. So there haven't been the same advances in treatments and diagnostics that there have been with other diseases. Partly because I think it's still seen as, you know, a disease of the poor, and because we've largely eradicated it in the West, it doesn't have the same attractiveness to donors and to the pharmaceutical companies too. Because the number of people affected by it is still also much smaller, even though grave, than say TB or than say malaria or HIV.
No. Well, one final question.
Yeah, I've got a very quick question. The role of private sector, particularly the role of NGOs, the non-government organization, international, local NGOs, they are at the forefront. Historically, they have been doing very well for every pandemic or epidemic, like epidemic cholera, for example, or even the eradication of the smallpox, for example. So the Global Fund itself is not on the ground doing by themselves, but they have collaboration with government and the NGOs. So your support to the local NGOs who are at the very forefront of implementation of the program. What is the strategy that you are applying in the poor countries, particularly those who are struggling with the TB, for example, the disease of the disadvantaged? So do you have the direct agreement or contract with the local NGOs?
We have many NGOs and private sector agents, some private sector agencies too, as what we call principal recipients or sub-recipients of Global Fund grants. So the way the grants work is that each country, Graham mentioned the country coordinating mechanism. So that's like the local board in each country to put in proposals and then monitor the implementation of the grants. The Global Fund will not, well, there's a negotiation around what will end up in the grant based on technical aspects, but it's really what the country asked for is what we respond to. And it varies in different countries how much civil society involvement there is. In PNG at the moment, we have Rotarians Against Malaria as the principal recipient for the malaria grant, working with the Health Department and the Institute of Medical Research. For TB HIV, World Vision is the principal recipient, and we have Save the Children, ADRA, the Hope Worldwide, Anglicare, and IGAT Hope, the positive HIV positive people's organization, as sub-recipients. So we have quite a considerable amount of civil society involvement, and the CCMs themselves, you're required to have the proportions. You can't be dominated by government. You find in countries where the chair and the principal recipient is the government, there's less involvement of civil society. And if there's one governance aspect that I would argue for strongly is to have an independent chair and to look broadly at how you want to.
I think again, the dominance of the big one, the big shots.
Yeah.
Even in the NGO sector.
Yes.
We can hardly hear about this very local, small or obscure NGOs, those who are capable of going through the grassroots level implementation. But
well,
they have
at the sub-recipient level, they're there, but maybe not at the principal recipient level. And that's partly because of the accountability issues and so on. I mean, in Papua New Guinea, at first, the National Department of Health was the only principal recipient. But when I was chair of the CCM, we had to ask the government to step down because we'd had a very bad audit and we would have lost all the grants. Unfortunately, the Secretary for Health was a very wise man and could see that the national interest was much greater than the department's interest, and wrote to the Global Fund and said, we're opting out. So the CCM then had to put out a call, expression of interest to other non-government organizations to become the principal recipient. And that's so in many countries. But it's often as a result of the government getting into trouble, rather than the government agreeing in the first instance that this is a sensible way to proceed.
Well, thank you, Lady Roslyn. Thank you. I hope that gave a bit of an insight as to the work that the Global Fund and Lady Roslyn and her colleagues on the board are doing. And as Paul said, there are many lessons that have come from the Global Fund experience over the last 20 years that are playing out now in terms of the international response to the COVID-19 pandemic, and will contribute to the work in the future. Lady Roslyn talked about the market shaping impact, whereby a lot of bulk buying is occurring around the world now, which is saving probably, I would estimate, $1 billion a year, or maybe more, which is going to those countries affected by the pandemic. So it's been a phenomenal experience. I'll now hand it over to the local chair, Paul Lucas.
Thanks very much, Graham, for coordinating tonight. And thank you very much, Lady Roslyn, for an excellent and informative talk for us. I couldn't but help thinking and reflecting. A few years ago, I was at the premiere in Queensland of Timor-Leste's first feature film. And in the film, they had a scene, and I was back with some friends, the parents and friends of my daughter, and one of them is an infectious diseases physician. And there was a scene where a young child had quite a serious, to me, ailment. And our friend said to me, this child will die from this. And it would have been picked up in Australia by the most simple of pathology testing and the most simple of treatment. And there is so much that can be achieved at relatively modest effort, if not a determined one, that can make such a difference. We often talk about low-hanging fruit, and I sort of think that the terrible thing in the developing world and in areas of our responsibility, there is so much low-hanging fruit that it is rotting. And we need to do something to stop that. So thank you very much for your wonderful contribution tonight. And as part of that, you get a complimentary year's membership of the AII Queensland branch. And I know that will now have everyone tuned in wanting to speak at an event, such as what you can get for that. And what you can get for that includes attending any of our events, either in person or online at no cost. And just to highlight for you a number of the ones that we've got coming up, already scheduled in over the next month or so. On the 4th of May, we have Greg Hood, who is the Chief Commissioner of the Australian Transport Safety Bureau, the accident investigation organisation, world class for aviation, shipping, trains, large heavy vehicle accidents. He's going to talk about Australia's role in international air safety and transport safety arrangements. In air safety, for air navigation, for example, we cover about 13 or 14% of the Earth's surface, more than any other country. We are going to have on the 20th of May, Federal Member of Parliament, Ted O'Brien, who will speak about the China question. Ted O'Brien has lived in China for many years, worked in the field for a lengthy period of time, current member for Fairfax in the Federal Parliament. And on the 22nd of June 2021, we'll have Professor Helen Bartlett, the Vice-Chancellor of the University of the Sunshine Coast, speaking about Australia's issues in relation to international students. Helen, of course, not only being a University Vice-Chancellor, but also ran the international campus of Monash University, very experienced and knowledgeable in the field. Plus, we've got a couple more that we're just bedding down the dates for. So there's always something. We're like, as Forrest Gump said, a box of chocolates, or Radio National, they say a box of chocolates. You don't have to eat every chocolate. You don't even have to like every chocolate. But there is a chocolate for you in the box that is the AIIA Queensland branch. Thank you very much for coming.